Most people think that depression and anxiety are diseases, and that's what doctors do. They usually tend to give a diagnosis and give a treatment. So people perceive that there's something wrong with them. They just get an antidepressive, an anxiolytic, or some medication that will try to balance their neurotransmitter production. Nevertheless, from my perspective, these are not really diseases. These are natural imbalances that all of us go through in our life. I have not met a single person, a single adult, that does not go through periods of depression or anxiety, with all the symptoms that are associated to them. Now, these imbalances that happen mentally, emotionally, and physically have unique triggers. The thing is, almost nobody knows what are the precise triggers for tipping over to the side of the balance of depression or tipping over to the side of anxiety. Once we understand there are 8 unique triggers that have to do with the brain cortex, that have to do with increased production of testosterone or increased production of estrogens, which make us behave in a much more outgoing way or in a more introverted way. These are usually survival mechanisms that help us cope with very complex outside situations we are confronting. And that is why also, now that we are all living this unique reality of the pandemic, these symptoms or these diagnoses have skyrocketed like never before. Some countries are reporting 2 or 3-fold the incidence of depression or anxiety. Also panic attacks, suicide attempts, and domestic violence, and many others. Now, once we understand which are the unique triggers to tip us over to depression or anxiety, we also get tools and we get insights of what we can do to come out of them in a much more effective and conscious way. Not only depending on medications and not thinking there's something wrong with us, because that just increases the problem. In body medicine, we teach this. We call them usually brain constellations. This is a term that was created by Dr. Hammer in the 1980s. When he discovered the 5 biological laws, he discovered exactly what are the unique triggers that create an imbalance in an organ of the body, which will subsequently create an inflammatory process. And sometimes we get diagnoses by this. But later on, he also discovered what creates the imbalances in our behavior, in our emotional states, that create situations like a manic depressive disorder, ADD, ADHD, bulimia, anorexia, all the so-called psychiatric diseases. Now, from this approach, they are not really diseases because we all have at least a little bit of all of these imbalances. And we all have unique triggers in our life that put us in that behavior and in that inner feeling. And they are all survival mechanisms. Any psychologist, psychotherapist, anybody who works with patients, for me, when they learn these unique triggers for these imbalances, they get invaluable tools to work with their patients and to be able to support them more integratively. For me, as a matter of fact, I have gone through these imbalances, and yes, it is not comfortable, definitely. And many people are going through this right now in the world, being in lockdowns, not being able to interact with their loved ones, probably losing their work, etc. And as a matter of fact, the amount of cases of these psychological imbalances that are happening in the world are, from my point of view, much more severe than the consequences of the virus that is supposed to be around. And I feel we need to address these issues today. We need to give as much support as possible, human connection, being out in nature, meditation, physical movement, balanced diet, and a few other details that once we address them and we address these issues in a holistic way, we have a much, much bigger chance of coming out of them, having well-being, balance, physically, mentally, emotionally, spiritually, feeling creative again, feeling, seeing life with its beauty, with with the colors and flavors and unique, the uniqueness of life, which is a gift for all of us. So yeah, I just wanted to share a little bit of this to give a few insights about depression and anxiety. And everybody's welcome to join any of the body medicine courses and empower themselves. You're all able to empower yourself with knowledge. It's your choice.